So, variations in health. We look at in Area Study 1 factors contributing to variations in health status within different population groups. So, we compare males and females, we compare Indigenous and non Indigenous Australians, we compare high and low SES, so socioeconomic status, and we compare inside and outside major cities, so rural and remote areas. So, factors that raise or lower the level of health in individual population. So we've got biological, sociocultural, and environmental factors. And the purpose of this is to explain and project trends in population groups and why some have better or worse health than others. So here are a bunch of biological factors that we look at. So I'm going to just briefly skim through this as we've still got so much content to go through. But you can always go back and download these slides. If there's anything that I'm going too fast through, just download them, have a look at it in your own time. And it's always good revision to do that as well. So we've got high blood pressure, which makes the blood pump faster, can lead to cardiovascular disease. Cholesterol levels are high, can cause cardiovascular disease. High body weight leads to obesity, strain on the heart, which can cause cardiovascular disease or type 2 diabetes. Birth weight. So if we have a low birth weight, we have a poorer immune system, which can lead to under 5 mortality rates for children. Testosterone, if we have high levels of testosterone, can lead to more risk-taking behavior, for example, drink driving. Estrogen, so that's this is what men have, this is what girls have. So estrogen, before menopause, reduce cardiovascular disease. After menopause, increase osteoporosis. So this is very simplified. I recommend going through your textbook as well if any of this doesn't make sense. But we're kind of just doing a bit of an overview today. So if you have any questions, just ask in the chat box. We also have genetic predispositions, which can cause cancer, obesity, cardiovascular disease, and what sex we are. So some diseases are exclusive to males or females. So breast cancer is for females only. Social cultural factors, so these relate to the social and cultural conditions into which people are born, grow, live, work, and age in. So food security, if we have poor nutrition, can lead to cardiovascular disease, obesity, osteoporosis, and diabetes mellitus. Poverty, our socioeconomic status, level of social support, employment, so unemployment, not being employed, can lead to poor mental health, cultural traditions, attitudes and beliefs, and early life experiences. Environmental, so we've got overcrowding, physical access to healthcare. So if we're located further away, we can't access it as easily as in the city. Water quality, our air quality, level of sanitation, hazard exposure, the condition of the roads, climate and climate change, and geographical access to healthy food. So now we're going to look at these specifically in relation to those groups that we talked about before. So if we look at factors that contribute to variations in health status between males and females, we've got, so these are the variations in health status. So if you want to look at these, like the actual difference in their health status, I find it quite fascinating. So life expectancy is about 4 years different. Males have higher rates of burden of disease. Males have high rates of premature death. There's lots of different data in there for each group for you to have a look at to see that difference in health status. But we're going to focus mainly on why this is occurring and the factors that cause this. So our genetics, so what sex we are, males store more fat around their abdomen, which is just a genetic thing. So they store more fat around their abdomen, which increases the strain on their major organs, which are located in that area, increasing the risk of cardiovascular disease. Whereas females tend to store their body fat near their hips and thighs, therefore they don't have as much of a risk of this cardiovascular disease as there's not as much fat in that area. Females also have high level of estrogen, which acts as a protective factor against cardiovascular disease during menopause. So this is a hormone that men do not have. So then genetics, if we're looking at hormones, males also have high levels of testosterone, which increase their levels of risk-taking behaviors, means they're more likely to have injuries and hurt themselves. Access to healthcare. Males are perceived stereotypically as the macho man image. So this is a stereotype which means they're less likely to access healthcare as they see it as a sign of weakness. This is a really bad one, as we shouldn't be viewing it this way at all, but a lot of men see it this way, which increases their risk of chronic conditions due to them not seeking early intervention or help, as they think that they're trying to be tough and not seek healthcare. Whereas women sort of don't have as much of this stereotype, so they're more likely to access healthcare and sort of get intervention quickly and heal and treat whatever disease they have. Unemployment. So unemployment, when unemployed, males often tend to feel more pressure than females, increasing levels of mental health issues, such as depression. Unemployed males have higher morbidity levels than unemployed females. So that's sort of another almost stereotypical thing, but when unemployed, males tend to experience more negative effects than women. And work environment. Males are more likely to work in outside occupations, which increases risk of skin cancer. They're more likely to work in transport and spend prolonged periods of time on the road, increasing risk of road trauma compared to females. Okay, now looking at Indigenous versus non-Indigenous Australians. So we've got all the data for the variations in health status on the side here, so make sure you have a look at that as well. But let's get straight into the reasons for these differences in health status. So birth weight. Indigenous Australians are twice more likely to give birth to low birth weight baby. So having a low birth weight baby has a lot of impacts on the baby. It's not good. It can be caused by sort of smoking and drinking while the lady's pregnant, and it can cause chronic conditions for the baby later in life. Socioeconomic status. So Indigenous Australians have lower levels of education attainment, lower incomes, and higher levels of unemployment. So socioeconomic status is made up of employment, income, and their education. So it's sort of those three factors combined. So Indigenous Australians have lower levels of all three. They're also less likely to understand and take notice of health promotion information, and more likely to engage in behaviours like smoking, poor diet, and physical inactivity, which can sort of contribute to their health status as well. So access to healthcare. Indigenous Australians are less likely to access healthcare as they face cultural barriers in receiving westernised healthcare. So sort of the healthcare that Australia is promoting, they might not resonate with, they might not feel comfortable accessing this type of healthcare. So they're less likely to access it, and therefore conditions can go untreated. There's less traditional Indigenous doctors or health centres available, which makes it hard for them to access healthcare where they feel comfortable. Housing. Indigenous individuals are more likely to live in overcrowded houses, putting strains on the bathrooms and kitchen, increasing risks of unhygienic living conditions and the spread of disease. Infrastructure. They're also more likely to live in rural and remote areas where roads are often poor quality. Combined with greater speeds, they have an increased risk of injury from accidents than non-Indigenous Australians. All right, we're going to just keep smashing through these, guys. Any questions, just ask, because I'm kind of working through this pretty fast because there's so much content for us to go through today. But we're just going to keep sort of smashing through it. So variations in health status for low versus high SES. So that's that social economic status, and we've got our education, employment, and if anyone can remember, and income. So it's sort of linked with employment, but yeah, education, employment, and income. I just had a mental blank for a second. That's what our socioeconomic status is referring to, those three factors combined. So if we're looking at like the low versus high SES, we've got birth weight. So people from a low socioeconomic status are more likely to give birth to a low birth weight baby, which, as we discussed prior, is due to smoking, drinking when they're pregnant, and can have chronic conditions occurring to that baby later in life, such as asthma. So access to healthcare, low socioeconomic status is likely to access, makes it people less likely to access healthcare if they're from a low socioeconomic status, as they may not understand the need of early intervention and diagnosis, which increases the risk of morbidity and mortality. Food security, so due to inability to afford nutritious foods, people from low socioeconomic status suffer from food insecurity, which means that they're more likely to buy cheap, high energy dense foods such as like processed packaged foods, which increases risks of overweight and obesity, also type 2 diabetes, cardiovascular diseases. Social exclusion, people from low socioeconomic status groups are more likely to experience social exclusion as they may feel disconnected, as they may not be able to afford like going out to the movies or going out for dinner or other things that people would do, and that might increase levels of mental health conditions. Housing, they're more likely to live in inadequate, unsafe, or overcrowded houses, with a lack of sufficient cooking facilities, ventilation, and increases risks of living in an unhygienic condition, increasing risks of mental health conditions, infectious diseases, and injuries. Okay, and last one, we're looking at the different factors that contribute to variations in health status between those living inside and outside major cities. So, birth weight, people that are, you can also refer to this as rural and regional, rural and remote, but I think in the study design they say within major cities, so it's always best to refer to what they say in the study design. So those living outside major cities are more likely to give birth to low birth weight babies, increasing the risk of developing chronic conditions later in life. So same again for that one. Social isolation. So because they're sort of living further apart from everyone, they may feel sort of excluded from social interaction, as there's that geographical distance between their family and friends and community, which can cause stress and loneliness. Work environment. People in rural and remote locations often experience outdoor work environments, so like farming, mining, and trade is more likely to occur outside major cities, which means they're exposed to hazardous work, so like the sun causing skin cancer, heavy machinery, like big machines or anything sort of dangerous like that, that's sort of outdoors, like mining and stuff like that, which can cause injuries. Whereas in the office, in the city, there's a lot more like office jobs, which are generally a lot more safe. The geographic location of resources, so the access to healthcare would be lower for those living outside major cities. They have to travel further to find healthcare, so it makes it sort of harder for them to access it. Infrastructure, outside Australia's major cities, the roads are a lot less safe, which can increase risks of road accidents and injuries. Also, the water quality is not quite the same, which can increase dental health issues and sort of impact their health as well. So, the questions for this tend to be quite formulaic. A lot of questions in health and human development are like in a formula once you get used to the marking scheme. But they'll sort of say, identify and explain how one factor of health that may contribute to the differences in health status of Group A and Group B. So most of the questions are pretty similar for this topic. So you identify the factor, an example, compare the population groups, and explain the example and discuss if it's a risk factor or a protective factor for certain conditions. And then step 4, link to health status variations between the population groups. So this is sort of a good basis to go for when you're answering questions, as they generally fall into similar wording as this. So select one factor of health and explain how it might contribute to variations in health status between those living in rural areas and those living in major cities. So 3 marks, we're talking about within and outside major cities. So we're talking about sort of the geographical distance for this one. So environmental, we're going to talk about the work environment. So those in rural and remote areas are more likely to work laborious jobs such as mining or construction. Due to spending prolonged periods of time outdoors, those in rural areas have higher levels of UV exposure. So sort of explaining that actual example that's going to have on them. So not just saying they work laborious jobs that are more dangerous, we're giving a specific example. So saying the UV exposure, this is a major risk factor for skin cancers such as melanoma that can also ultimately cause death. This contributes to a lower life expectancy. So we're referring to a specific example of health status. So remember when I said health status, whenever you see that, refer to one of the indicators. That's what we're doing here. So lower life expectancy is the indicator we're using. So yeah, health status, refer to one of the indicators. Okay, back to where we were. Contributes to a lower life expectancy amongst rural and remote populations compared to major cities. So yeah, we've talked about a specific example. We've talked about the negative impact, so how it can affect people living outside major cities are negatively impacted as they have more UV exposure, which is a risk factor for skin cancer, which can cause death, reducing their life expectancy. So see how it's like a cause and effect, one thing leads to the other. That's sort of how we want to structure our response for a question like this. Yeah, so health status means use an indicator like life expectancy. Okay. So that's sort of just a bit of a breakdown of the question that we just did, if you want to have a little bit more of a look at that one. So factors influencing health status and burden of disease, we've got a bunch of dietary risks as well as high BMI, alcohol and smoking that can impact our health status and burden of disease. So smoking is our first one. So smoking can lead to cardiovascular disease, cancer, respiratory conditions, low birth weight and communicable diseases. So I'll quickly go through each one, sort of how they lead to it, but we've kind of got to get a move on. So I'm only going to briefly go over it. So cardiovascular disease, smoking increases blood pressure. The chemicals cause atherosclerosis, which is a buildup of plaque sort of on our blood vessel walls, which makes it harder for the blood to get past, which increases our risk of heart attack and strokes. Cancer, so the toxins in smoke can damage DNA. That some of this DNA is used to protect us from cancer. So this can cause abnormal mutation of cells, and the tumor can potentially be cancerous and cause lung cancer. So respiratory conditions. The respiratory tract is a set of mechanisms that protect the lungs from injury, but the chemicals that are inhaled when smoking overwhelms this system, damages the airways, and reduces the airflow that gets to the lungs, which can cause conditions such as COPD, so chronic obstructive pulmonary disease. Low birth weight, so this is sort of what we were referring to before. So mothers who smoke during pregnancy increase the chances of a low birth weight baby, as the fetus is sort of getting sent through like all the different toxins from the smoking rather than nutrients, which risks premature death. Then communicable diseases, so these infectious ones, by smoking it lowers our immune system function, which increases the chance of us developing an infectious disease like pneumonia. So now we're looking at alcohol. So we can get liver diseases. So alcohol is filtered through the liver. If we consume too much alcohol, it can scar this liver tissue and cause cirrhosis of the liver. Child defects. So if we consume alcohol when pregnant, it can increase the risk of fetal alcohol spectrum disorder, as well as low birth weight and premature death. Cardiovascular disease, it can cause weight gain, as a lot of alcohols are very high in calories, and if they consume a lot of these calories from alcohol, it can lead to obesity, excessive body weight as a risk factor for cardiovascular disease, type 2 diabetes, and other cardiovascular diseases due to greater strain on the major organs. We can also get injuries, as alcohol lowers our inhibitions because it's a depressant and it makes us sort of not think as logically, which causes greater risk-taking behavior, such as drink driving, which can cause injury, obviously. High BMI. So high BMI can lead to cardiovascular disease because there's a greater strain on the heart because we have sort of a larger body mass. It increases hypertension, which is high blood pressure, and atherosclerosis, which can cause a heart attack and stroke. Cancers, so fat cells inhibit normal cell growth, and those overweight or obese have chronic low-level inflammation. So by having a lot of those fat cells, which sort of interferes with normal cell growth and causes a lot of inflammation, can cause DNA damage and lead to cancer. We've got type 2 diabetes, so high BMI decreases the ability for cells to metabolize glucose, which can cause insulin resistance, which can then lead to type 2 diabetes. Arthritis, so because there's extra pressure on the joints, it can increase the inflammation and stiffness on the joints. And mental health conditions, so a high BMI increases the risk of conditions such as anxiety and depression, especially amongst children. The only thing to note is that high BMI in general is sort of not the most accurate way of measuring a person's health, as if we look at LeBron James's BMI, sort of it's measured by weight over height squared, but because sometimes this isn't necessarily a good way at looking at health, he's technically classed as overweight, but he's a very fit and healthy individual. So BMI, kind of take it with a grain of salt. It's not always the most accurate, but in Health and Human, it can be helpful to see it as a risk factor for disease. So if we look at the dietary risks, we've got quite a few. So underconsumption of the essential micronutrients in vegetables. So we're not getting that fiber, which promotes fullness, which if we do get lots of fiber from eating vegetables, it can reduce weight gain, as we're not eating as much because we feel more full. They provide a source of antioxidants, which removes free radicals from the body, which decreases our risk of cancers forming, such as gastrointestinal and colorectal cancer, as well as cardiovascular disease. Vegetables are also high in nutrients like vitamin C, which promotes immune function, so we're less likely to develop infectious diseases like the flu. Fruits are a rich source of fiber, which promotes fullness, which once again reduces weight gain. Source of antioxidants, same thing as before, and a source of nutrients. So during pregnancy, nutrients pass through the placenta to the fetus, so reduced risk of neural tube defects and less infant mortality, therefore. We also have an underconsumption of dairy in Australia, so this could be milk, yogurt, cheese, you probably get the picture, but dairy is a rich source of calcium, which is required for ossifying hard tissue. So our source of calcium helps us to achieve peak bone density, and if we consume lots of dairy, we're less likely to have porous bones by achieving that peak bone density, which reduces our likelihood of osteoporosis or injury later in life. It gives us strong bones that are less likely to break and sort of have holes in them and have issues with our bones. So it's really important to have lots of dairy because it strengthens our teeth and also reduces the risk of like dental caries, which are like cavities that we have in our teeth. Lipoprotein, so this is in relation to fats, which we're going to look at in a second, but we have two types of lipoproteins, or like cholesterol. So we've got LDL, which is low density lipoproteins, which is the bad cholesterol, so we don't want a lot of this in our diet. They are ineffective at carrying cholesterol. They tend to deposit it on the artery walls, and they're found in trans and saturated fats. So any fats that's sort of solid at room temperature, so like butter, like butter and I don't know, I guess you could say like chocolate or whatever's in chocolate, but like any fat that's like very solid, whereas HDL is more like your olive oils, like olive oils, sunflower oil, that kind of thing that's liquid at room temperature. So HDL is our good cholesterol, prevents or reverses the buildup of plaque on the artery walls. It delivers cholesterol to the liver where it's disposed of, so it helps us sort of counter the effects of our bad cholesterol. So we also have trends in Australia of high intake of fats, salt, and sugar. So we're going to look at the effects of each of these. So high intake of fats, so specifically saturated and trans fats as our mono saturated and polyunsaturated fats are good for us in small amounts. So that's, as I said, like olive oil, natural peanut butter, those kinds of things. But those saturated and trans fats aren't so good for us. So these increase the risk of cardiovascular disease, obesity, and cancer. Too much LDL or bad cholesterol in the blood is deposited on the artery walls, hardening and narrowing the arteries, which can lead to atherosclerosis, which is a type of cardiovascular disease. Fats are energy dense, so they tend to have more calories than carbs and protein. So if not consumed and if not consumed, is stored as adipose fat tissue. So that's sort of fat located around our body, which can lead to weight gain over time, which places strain on the heart and increases a risk of coronary heart disease. This is one of the leading causes of death in Australia, by the way. Okay, high intake of salt, so things like olives, cured meats, like salted snacks, anything with like a lot of salt. You probably know more examples than me. So sodium is required to regulate fluids, so blood and water in the body. It's needed for like pH function and everything like that, and sort of our electrolyte balance. Fluid is drawn to sodium, so the amount of sodium influences the amount of fluid in and out of cells in the bloodstream. But if we have, so basically salt's really good for the body, but we shouldn't have too much. So if we have too much sodium, this causes the body to draw excess fluid out of cells, which increases our blood volume and thus contributes to hypertension or high blood pressure of the heart. Excess sodium also causes calcium to be excreted through the urine. So we're taking the calcium from our bones and we're excreting it out, which leads to our bones being demineralized. So that's definitely not what we want, which this over time can contribute to osteoporosis, sort of breaking down our bones. And high intake of sugar, so lollies, soft drinks, fruits, all those kinds of things. The consequences of this excess sugar in the diet can be, we can store it as adipose fat tissue because over time it can lead to weight gain and a high BMI, which is a risk factor for other diseases. Also sugar, I forgot to mention, sugar is high GI, so has a high glycemic index, meaning that they're sort of quick to break down, they release into the bloodstream a lot quicker. They also get used up a lot quicker, so that means we feel hungry quicker than we would if we had like a balanced meal with like carbs, proteins, and fats, whereas we have just high GI sugar, it gets sort of absorbed very quickly and then soon we're hungry again. And that's why you sort of have those sugar crashes where you feel really energetic and then you crash. Sugars provide a food source of bacteria for bacteria in the mouth, so it can contribute to dental decay and the development of dental caries in our mouth. Sugars also raise blood glucose levels, which can lead to impaired glucose regulation, which can then lead to type 2 diabetes. So impaired glucose regulation is kind of like the onset, like before type 2 diabetes, and then once it gets worse and it's not sort of treated or addressed, it can lead to type 2 diabetes. Then some other dietary risks. This topic kind of goes on forever, but we're still going. So low intake of fiber and iron are another trend in Australia. So low intake of fiber obviously has its effects because fiber is a type of carbohydrate. It regulates the functioning of the digestive system. So soluble fiber attaches to particles of LDL cholesterol to excrete them, which is what we want. We want them out of the body because LDL, remember, is that bad cholesterol. Decreased levels of LDL cholesterol in the body reduces our risk for cardiovascular disease. So fiber also absorbs water to add bulk to the feces, which reduces the risk of cancerous tumor forming. So helps sort of move things through our bowels, which reduces the risk of colorectal cancer. It also promotes fullness, which links sort of back to fruits and vegetables, reduces the risk of over-consuming energy-dense food, preventing weight gain that can lead to obesity. Iron, so we need iron in our diet as well, as iron helps to produce hemoglobin in red blood cells, which is responsible for transporting oxygen around the body for energy. So we definitely need iron because our red blood cells are very crucial in our body. We need oxygen transported around us. So that's why if you have low iron, you might feel very fatigued or lethargic or not like you have a lot of energy. So yeah, if we have a low intake of iron, we have diet-related deficiency diseases such as anemia, which gives us fatigue, paleness, and breathlessness. All right, so now we're going to look at practice questions. Once again, feel free to have a go at this in the chat box or come back to this later and have a go for yourself. It's always good to do practice questions, but I'm going to quickly read through this, but you can always come back later. So outline how excessive sodium consumption can have an impact on health status. So hopefully you guys picked up on health status. When it says health status, what does that mean? It means that we need to relate to one of the indicators. So, excessive sodium in the body draws water into the bloodstream. This increases blood volume, and it can lead to hypertension due to a greater strain on the heart, which is a risk factor for a stroke or heart attack, increasing mortality rates and thus decreasing life expectancy. So mortality rates and life expectancy, they're the examples of health status that we used in this example. And we've talked about the actual biology of what's going on. So we can't just say excessive sodium increases mortality rates and decreases life expectancy, because that wouldn't be enough information. We've talked about how this actually occurs. So it draws water into the bloodstream, which can lead to hypertension, more strain on the heart, which is a risk factor for a stroke or heart attack, which then causes mortality and decreased life expectancy. So that sort of chain of events we want to make sure we're including to explain our answer to make sure we get full marks. So a mark for the function of sodium, a mark for a link to health status, and a link to a condition, even though it didn't specifically ask us to link to a condition. We've talked about stroke or heart attack specifically. Yeah, so we always want to try and write in a cause and effect format.